presidential health compact has been rejected by some healthcare professionals and business lobby groups who say that they will not be part of it. The initiative is part of President Cyril Ramaphosa's bid to establish a framework of cooperation with the various stakeholders in South Africa. The aim of the compact is to provide a better universal health care in the country and was signed by the acting president, Paul Mashatile. Let's get some reaction now on this issue with the DA's health spokesperson, Michéle Clarke. Michéle, a very good morning to you. Thank you so much for making time for us this morning. So the DA has come out to actually commend organizations like BUSA as well as SAMA for not signing the presidential compact. What's at the core of the issue for the Democratic Alliance when it comes to the presidential compact if you compare version 1 to version 2?
Thank you, Aldrin, and good morning to your listeners. Well, you know, the Presidential Health Compact is done on an annual basis, and it really is collaboration between civil society, business, and the medical fraternity, as well as public healthcare players. This year round, the NHI was included into the compact, and I think very disingenuously, because that part of the compact is still very much up for discussion. So during the President's SONA debate, the President had announced that there would be a much broader discussion amongst business as well as civil society in terms of the NHI, because there's a huge outcry in terms of certain sections of that law, which is now law, it's no longer a bill. And that just didn't happen. Yet they inserted the NHI within the compact, and therefore SAMA and business who do not support the NHI in its form as it is, would not sign that compact. And I think I must make it very clear that the Democratic Alliance and Business for South Africa and SAMA, we all support quality universal healthcare for this country, but there's certainly a lot of issues around that law that needs to be addressed. And therefore, they were not prepared to commit themselves to that compact.
Yeah. So if we didn't have the NHI element or NHI being centered in this particular document, do you think that the document would still be viable?
I do think so, because I've attended several of those, the presidential compact meetings that we have on an annual basis, and there's a lot of good discussions that go along with collaboration in terms of business and SAMA and civil societies in terms of healthcare in this country. And we certainly in this country cannot just exclude those role players in terms of healthcare, because it's very important that we form partnerships in order to ensure that we uplift the healthcare within South Africa, the public healthcare, which is actually in dire straits at the moment.
Mm-hmm. Do you think it's possible to do it simultaneously, while on one end you have the government of the day, which includes the Democratic Alliance, pushing for the implementation of the NHI, whereas on the other end as well, you deal with some of the issues that the Democratic Alliance are raising as concerns when it comes to the NHI? Because again, this document centers the NHI as the most viable option, and considering now that the Act has been signed as well, to implement quality health care as well as universal access to that quality health care.
Look, I think the problem around the NHI in its current form has many issues that need to be addressed. And when the negotiations of the GNU took place, NHI obviously for the Democratic Alliance was a red line. And, there was definitely a point put on the table to say that there would be a commission established with all role players of the GNU in order to discuss those issues and then bring that law back to Parliament and to adjust that law once that commission has finalised. And that, I think, is what civil society and the medical fraternity, as well as SAMA and business, is wanting to happen. And our problem now is that the Minister of Health is just forging along with the NHI, not thinking this matter through, and the repercussions NHI could have, not just on the medical side of things, because that certainly needs to be uplifted and has to be sorted out, but also in terms of the country's well-being, because many people are saying they're going to be leaving this country if certain things aren't addressed within this law. So, you cannot just exclude private healthcare in this country. They play a critical role in order to assist public healthcare to be uplifted. And I think it also becomes private healthcare's responsibility to collaborate with government in order to do that, so that we can ensure that our hospitals are a better space to treat our patients and they get good quality healthcare from our public hospitals, because that's certainly not the case at the moment. And most of our hospitals also don't align with the ideal clinic specification that's within the NHI that they need to do. And the Ombudsman and his staff component, they just don't have the capability in terms of staff component in order to do what needs to be done, because they're so short-staffed and their budget just does not allow for them to do certain work they need to be doing in order to ensure that hospitals align to the ideal clinics document.
Yeah. So Michéle, would a document like this, for instance, go through the GNU, and you have to find sufficient consensus before it is even tabled before Cabinet? Because for me, the thinking is that you have the chairperson of Cabinet, who is the president. Well, it was the acting president who signed this particular document. Of course, with the endorsement of the president, who is the chairperson of Cabinet. How would the GNU then work around a document of this nature, knowing very well where the Democratic Alliance stands when it comes to NHI?
Well, this is in actual fact what the negotiations was around the GNU, that this document, once the Commission has finished working on the document, would then go to Cabinet in order to be discussed and approved, and obviously then come to Parliament. And that is what we want to see done.
So that didn't happen?
No, it hasn't happened at all. They haven't started it at all. The Commission hasn't even been established yet.
Yeah, so what does this mean then for the GNU? Because on one end you have these set of rules that you've all agreed to, and yet it seems as though that the chairperson of Cabinet would then go against that particular rule, according to your interpretation of what is expected to have been done.
Well, in terms of my interpretation is that, the discussion around the Commission through the President should be established as the President had promised. And Minister Motsoaledi needs to be part of this discussion and not just forge on with the NHI, because I think it creates a really destabilized platform in terms of the GNU. And at this stage, when you look at the work that's been done by ministers and that within the GNU, there's some really good work being done, and it would be really a sad state of affairs if this does not continue happening, in terms of this commission.
Well, at least Article 8 of this document does speak to the establishment of a National Health Commission to drive intersectional action to achieve healthcare outcomes and enhance continuous leadership and governance through opposite development programs. But in conclusion, Michéle, is the Democratic Alliance still pursuing court action against the implementation of the NHI Act?
Well, if the Commission is not established and the discussions don't take place, and the broader consensus around NHI in terms of civil society and business as well as SAMA is not taken into account, as the President said we should go into those discussions, we would still continue with court action against the NHI.
Okay, thank you so much for your time. That is the DA's health spokesperson there, Michéle Clarke. Really appreciate your time. I'm going to take